Hello again, everyone. My name is Jerry Rothkoff. I am the managing partner and founder of Rothkoff Law Group, an elder care law firm located and serving our clients both in Pennsylvania and New Jersey. Thank you once again for viewing our continuing virtual question series regarding who's who of elder care advocacy. And today, I am honored to have my dear friend Jennifer Fitzpatrick with us. Jennifer is the founder and president of Generations Health Education, which, and many of you I'm sure have heard Jennifer speak. We've had Jennifer multiple times speak at one of our seminars over the past several years, and it's an honor to have Jennifer. Jennifer, welcome.
Thanks, Jerry. It's great to see you.
It's always great to see you, and you do some fantastic things, and you have so much to say about advocacy for seniors and educating our long-term care professionals and others, both locally and nationally. And Jen, you know, it's I know we had an opportunity to get together. It seems like decades ago, but really only the past several months ago. We saw each other and our spouses in New York City at the end of February of this year. And, you know, at one of our favorite charities, HFC, or Hilarity for Charity event, which we can talk a little bit about in a bit. And my, oh my, the world went upside down 2 to 3 weeks later, right? And we were hanging up, having a great time, having a drink together, and look what has happened over the past 8 months since that time.
Yeah, we were in New York City, and we hung with your lovely wife, your beautiful daughters. My brother was there, and who would have thought back in the end of February that we would still be in this situation in October. So yeah, I mean, so much has changed. There's been so many changes to the way older adults are receiving services right now. But yeah, that HFC event was pretty fantastic. And I know you all just sponsored another HFC event, the charity founded by Seth and Lauren Miller-Rogan. So yeah, lots has changed since then. And hopefully we're learning from all this that's happening right now.
Yeah, so we'll come back to the pandemic because it's always the elephant in the room, so to speak. Unfortunately, no matter how you slice it, it always comes back to COVID-19 and what we're doing. But let's talk way before anyone heard of coronavirus or what the hell that meant for us in society. Let's talk about you a little bit. So, you know, tell me a little about Generations Health Education. I mean, I know you have spoken locally in the Philadelphia, South Jersey area multiple times. So many long-term care professionals, at least locally, have seen you and heard the great things you had to say and helped educate them and provide them the necessary continuing education credits. But, you know, Generations Health Education has been in existence for how long now?
Yeah, about 15 years now. It's been a while.
So what was the impetus to start your company? And you know, can you talk about how you've grown over the past 15 years?
Yeah, sure. So I actually grew up in the Philadelphia area. My family grew up in Northeast Philadelphia. Most of my family's still in the Philly area. My brother is a Cherry Hill police officer, detective actually. And I went to Cinnaminson High School. And actually, I worked for a couple of nursing homes in South Jersey. They've changed names, but when I was 16, when I was in high school, and I worked in reception on weekends and evenings, and I did activities. And this is before there was certifications and everything. This is well over 30 years ago. So I started out in this field and went to college, got a social work degree, got a master's in social work. And I wound up working mostly health, mental health on behalf of older adults. And ultimately, I started teaching college almost 20 years ago. And I had some students in my classes that were saying and I would teach gerontology. And I had students in classes that were saying, oh, I work in an assisted living, I work in a nursing home. Can you come to our community and talk about this topic we just talked about in class, because I feel like it would be helpful. So that's really how I started the company. And it's definitely evolved. I really didn't plan on having a team work with me ever. I really sort of was just like, I want to present, I want to speak, I want to write. And I've been very, very fortunate that pretty much everybody that's on my team over the years sort of has found me. I've never advertised. It's always been folks that kind of hear about what I'm doing, and we mesh, we connect. So we have grown for sure. And that's a little bit about where I started out. I had great relationship with my grandparents growing up. They had a huge role in my upbringing. And so I've always been a big fan of the older adult, and especially now that I'm moving toward becoming an older adult, I'm sure that all of us eventually, if we're fortunate, we see that we're getting closer to that older adult age.
What's some of the new, obviously, I'm not talking about, you had a pivot, obviously, but from in-person for the most part to virtual. I understand and get that. In other words, the content in some ways remain the same, but the form changed a bit, the delivery changed. But I'm always interested in the new stuff. I'm always interested in the innovative things. So tell me, if you could, what did you have to change for the content wise to address what's been going on with your presentation of the past 7-8 months? Is there any, or any new content that you had to add, that you never even thought about 8 months ago?
Yes. So basically with Generations, we really have 3 brands. So Cruising Through Caregiving is the book that I wrote for family caregivers. And so we do a lot of work with the family caregiver. So Cruising Through Caregiving, then we have the CE component that is for, like, mostly know me from doing CEs for professionals, financial, healthcare, mental health, legal, and then the keynote business. And so the caregiving side of it is, I think family caregivers are going through such a unbelievable challenge, because one of my biggest suggestions and emphasis of Cruising Through Caregiving has always been, you got to have a crew. I use boating analogies. You've got to have a crew. You got to have people as part of your life. And a lot of family caregivers during all this have pulled back. They don't want other people in their home helping. They're in some ways like, should I move my loved one to senior living right now when maybe they're not having access to the activities and programs that they were able to? Now, senior living, nursing homes, they're all doing the best that they can under these circumstances, but these are new obstacles that I think family caregivers are facing, and we're seeing more and more burnout because of that. Before the pandemic, I think most of it was just breaking through emotionally. Like, you don't have to do it all. You can get help. It's okay to bring home care in, utilize adult day, move to senior living or nursing home. But now it's, oh my gosh, am I going to be able to see my loved one if I move them? Or what if this person comes into my home to provide home care, or even a neighbor or a friend or a family member, and they bring COVID, or they bring some other disease? Because, by the way, COVID is not the only thing that causes problems for healthcare. But I think there's just been this whole psychological barrier to getting more and more help right now. So that's one area where we've seen a lot of burnout and stress for family caregivers.
And by the way, and I should have brought it, I should have it in front of me, and I apologize, I don't. Your book, Cruising for Caregiving, is fantastic. And we, unfortunately, 8 months ago, we were handing your books out to our clients, or more importantly, they're the caregivers of our clients. And of course, since most of our clients are not coming in person, we haven't had the ability to hand them a courtesy copy of your book. But if anyone wants a copy of your book, it's online, obviously. It's fantastic. So it's a must read for anyone who deals with care issues, whether the caregiver themselves or if you're a professional counseling the caregiver. as well. So,
Thanks, Jerold.
so it's fantastic. And I apologize. I have it downstairs in my office, but I could grab it, but it would just be an empty screen for now. Then, so
We don't want that.
And what about, since you are constantly communicating with both professional caregivers and lay caregivers, what are you hearing now? What are their main needs? What are you seeing out there that obviously we understand issues related to isolation is huge now, but what are you hearing? What needs are not being met?
So for professionals or for families, Jer?
We'll take both. Whatever you want to, wherever
Sure.
you want to take it, the question. You can
Sure.
be like a
So
politician and just totally ignore the question.
I could do that.
And just talk about the weather if you like, but that's up to you.
So professionals right now, I feel like are just in such a tough situation. Professionals that are in health and mental health right now, because a lot of their tools for serving older adults have been robbed from them. So for somebody who has Alzheimer's disease, for example, touch, we're being so careful about touch. And we know that touch is such a powerful way to communicate with somebody with dementia. And we have to be so careful right now because of everything that's happening. The whole thing with masks is robbing professionals of, in most communities, if someone has dementia, we're not asking the residents to wear masks, but for the healthcare professional, it's very hard for the person who has dementia to be able to see facial expressions. And are you smiling? Are you grimacing? Are you frowning? That's a challenge for healthcare professionals right now. I think for a lot of healthcare professionals, the anxiety of, okay, well, if I'm working with COVID-19 patients, will I be bringing this home? So I think we have to be grateful and showering our health and mental health professionals with as much appreciation as possible, because I feel like in so many ways, we've tied their hands being able to do what they do. And there are reasons that officials are asking them to do certain things or avoid certain behaviors that they used to be able to do to get their jobs done. But I think it's very, very important for us to acknowledge how tough their jobs are. And I applaud the companies and the organizations who are giving hazard pay and who are doing there's a lot of organizations that I work with that are they're giving groceries to their staff to thank them for working. And those right now, that is huge, just showing appreciation. I think in especially senior living, older adult care, we had a hard time attracting people to our industry. We've had a shortage for pretty much every profession for many, many years, hard to hire. And now we're making their jobs even harder. So we've got to show them as much appreciation as we can. So we keep folks engaged as much as possible.
Yeah, I totally agree. And in many cases, COVID is now the impetus for long-term care reforms, but arguably have been long overdue. I would say that COVID did not cause many of the current problems with nursing homes. COVID brought the symptoms of those problems to the surface.
Highlighted the problems, Jer.
Exactly.
And, so one thing that, my husband and I talk about this all the time, if we were in charge, I'd love to see, instead of maybe all these businesses shutting down and we're giving people all this extra unemployment, could we give that money to nursing homes so people don't have to have roommates anymore? Maybe we give grants. I mean, we want to socially distance. If someone has COVID, we don't want them, there are still nursing homes where you have 3 and 4 residents in a room. That's inhumane. And I'm not blaming the nursing homes, because they have to do what they have to do to stay in circulation so they can serve residents. But even having one roommate you're 70, 80, 90, 100 years old, you need your privacy. And so wouldn't that be great if we were able to figure out, and again, I'm not a policy expert, I don't know how this would all work, but wouldn't it be amazing if we put some of these resources for COVID safety, maybe instead of paying certain unemployment benefits to people who are pretty low risk, who could be out there doing their jobs, put it toward some of these organizations and make their spaces more conducive. So if there is another pandemic, once we get through this COVID-19, that it wouldn't spread as quickly through a nursing home or an assisted living. And by the way, I think really it's more sadly a nursing home problem because people are much more on top of it.
Environment. Yeah, I think we're going to have to, I mean, it's way beyond the scope of our discussion today. But yeah, I mean, we need to it's not one thing. We need to reinvent long-term care from the bottom down up, inclusive of nursing homes, and change the environment of the nursing homes. I interviewed a doctor who's escaping me. He's in the Richmond, Virginia area, who was at the forefront, and he's looking to build more congregate housing for seniors in a nursing home setting in the Richmond, Virginia area. And that's really, Dr. Wright is his name. So that's more what we're looking for. And but I mean, there's not one solution. I would agree with you in the sense, without getting too high on my soapbox here, society is to blame. And I think we all have a role to play the government, the long-term care professionals, owners or operators of nursing homes, their regulatory issues. There's plenty of blame to go around. And these issues existed long before COVID came to the surface. So it's a fascinating discussion. There are no easy answers, but one thing I would say we can't do, and that's nothing, because to continue, of course, down the same road, of course, you reach the definition of insanity, right? So the status quo can't remain. The question is, what do we do? And I mean, and like you, Jennifer, I don't profess to be a policy expert, but I will let those who are far smarter than I am on these issues weigh in, and if I can contribute in any small way, fantastic. So, Jennifer, before we go, if someone wants, I know you do a lot of speaking engagements now, of course, virtually. If someone is interested, if a caregiver group or a long-term care professional is interested in inviting you to speak, how can they get in touch with you? And you can give out your fantastic book information as well.
Oh, thanks, Jerry. So cruisingthroughcaregiving.com if you're interested in the first chapter of the book and all the worksheets. JenniferFitzpatrick.com for keynote inquiries, and Generations with a J, generationshealth.com for CE events and those types of programs. But yeah, I appreciate the opportunity to talk to you about everything that's going on right now. And hopefully we can be part of helping organizations find solutions right now.
Great. Jennifer Fitzpatrick from Generations, thank you so much for your time today. It was enlightening. It's always fun to speak with you because it's always a fascinating conversation. So thank you. And hopefully, as you said, we'll see each other in person in the not too distant future.
I hope so.
All right. Bye-bye now.